Hi, my name is Davis Smith. I'm a doctor of internal medicine. I'm the director of health services for Westminster School in Simsbury, Connecticut, and I also work as a staff physician at the University of Connecticut Student Health and Wellness. Today, I'm here to answer Amanda's question, which is, are masks actually useful in preventing virus spread, or do they provide a false sense of security? Let's start first by talking about how COVID-19 is transmitted. Like many viruses, respiratory droplets are a very important mode of transmission. And unlike other viruses, they're really the primary mode. So if you think about yourself outside on a cold day and the cloud of vapor that you make when you exhale, that's a good way to think about the kind of space around you in which your air droplets can go. And likewise, the air droplets of somebody else. And so that's how we get that 6 feet of distance, because air droplets go away from us. They're very concentrated near us. The further away from us they get, the more dispersed they get, and eventually they fall out of the air. So that's where we get that CDC close contact guidance about being within 6 feet for more than 15 minutes in 24 hours. But of course, those are really just guidelines on a public health level. So a given individual could acquire COVID much more quickly. For example, if they were very close to somebody, if somebody was speaking forcefully or singing or coughing very close to them, that generates a lot of respiratory droplets into the air. And another person breathing those droplets in would be exposed to a lot of virus particles and very at risk to get infected by the virus if they weren't protected. So masks give protection in both directions. They do what's called source control. So they protect somebody that has COVID-19 from letting their respiratory droplets get out and mix with other people. And of course, if somebody knows they had COVID-19, they hopefully are staying at home and isolating and following proper procedures that way. But if they have it and don't know it, then the mask is going to protect them. It's going to capture those respiratory droplets as they come out. And by similar token, if you are wearing a mask, you are filtering the air as it comes into you and hopefully capturing most of those respiratory droplets. So we want a multi-layered mask, 2 or 3 layers, close fitting. The cloth masks are very effective. Any mask that's comfortable enough that you're going to be wearing it a lot is the best mask. Again, 2 or 3 layers is good, and the medical masks do have the added advantage of a little bit of static electricity that captures the droplets even more effectively. Now, I know that a lot of my audience here are college students, and for many college students, COVID-19 is a nuisance. Really, it's the quarantine that's a problem for them, right? Somebody in their close contact group is positive, then they're required to quarantine. And people don't typically know somebody that's had a bad time with COVID-19. And that's a good thing, big picture, but it makes people maybe a little less attentive to what they can be doing for the community. So I just want to point out one piece of data that I find really compelling, which is when a wave of COVID-19 infections go through younger people in a community who generally do very well with it, happily, luckily, that infection then will cause spikes in other groups in the population. So older people, more vulnerable people, people who don't have the robust immune systems that young people often do, and therefore with more serious consequences. It's quite clear that the risk of COVID-19 outside is not high at all, especially if people are moving or active or there's a breeze or whatever. Again, if you're super up close to somebody, you can still acquire it because you're getting that much of their breath. But generally speaking, it's not that likely to be transmitted outside. So indoors is really where we want to focus on the masking if we're not otherwise protected. Well, in terms of COVID prevention, I talk about the 4 pillars of mitigation. So you want to maximize masking, you want to maximize distancing, you want to maximize hygiene, and you want to minimize mixing. So I think the masking is obvious. The hygiene is really about hand washing. Some of the cleansing of indoor spaces is probably not contributing a lot. Distancing also important. If we don't need to be close to people, to be thoughtful about that and give ourselves extra space. And then the mixing, this is a thing where we just have to consider the risks that we're taking when we're in groups of people, especially in an indoor space. We've talked about the masking. Masking is definitely valuable, does not provide a false sense of security. It provides a real live, very effective security. Thanks for your time and attention. Thank you, Amanda, for your question. And I look forward to answering future questions for you all. Take good care.